continue now. So this is the medical certificate, the international medical certificate of cause of death. It has two parts. We have, let me actually say it has three parts. The first part is what we refer to as the demographic information. The second part is what we call the medical data, frame A. And then the third part is what we call the other medical data. Okay, so let's look at these parts in detail. So the administrative data, this is the section, as we shall see somewhere down, when countries are adapting this tool, this medical certificate, the international medical certificate, this is actually the section where a lot of the adaptation happens. Actually, what we emphasize is that when the countries are adapting the death certificate, they should not remove or drop any information on what is already there. They can add. You can add information, but don't remove information. So frame A is the medical part, and then frame B is the other medical data, as I already mentioned. So the administrative information or the demographic information, this here, the country should decide what information should be captured under this. You might want to include the residents of this place. You might want to include the district information. You might want to include the other socio-demographic characteristics like education, occupation, income status. You can include as much information as you want at the country level. The guiding principle here is the level of data disaggregation that you need at the country level informs how this administrative data is adapted. So if you want a lot of information, you can add. You want to disaggregate data by sex, by age, by residence, by occupation status, by education, and so on, by district, by province. This is where you can actually put as much information as possible. Where countries have national registration system, and this information is already included, all that you do is if you enter the person's national identification number, the section should be able to automatically update, especially if you are using an online electronic medical record system for medical certification of cause of death. We have already supported Uganda to build this medical certificate as an online tool. So in Uganda, all that you do is once you put the patient's national identification number, all the information on the age, the sex, the place, and so on, even the facility automatically populates itself so that you don't have to take time to fill these sections. Then the frame A is where now you record the sequence of events that have led to death. As I mentioned earlier, 4 lines have been provided for recording the sequence of events that led to death. The immediate cause of death is always recorded on the first line. I've put here line 1A. In many cases, this may be the only condition recorded if there are no other conditions in the sequence. So where you have only recorded one condition in line A, and you have not filled line B, line C, line D, in most cases, line A is both the immediate cause of death and is also the underlying cause of death. I want to repeat this. If you have only filled one condition in line A and nothing in B, nothing in C, nothing in D, line A is also an immediate cause of death, and also it is an underlying cause of death. There are many situations that you will find like that. Okay, somebody dies of gunshot wound. Okay, it's a gunshot wound. The death is instant. A gunshot wound. So the immediate cause of death is a gunshot. The underlying cause of death is gunshot. There are situations where only one condition is recorded in line A, and that condition cannot also be the underlying cause of death. For instance, if you record underlying cause of death for a mother as severe hemorrhage, okay? Severe hemorrhage cannot be the underlying cause of death. You need to do more to find out what caused the hemorrhage. That the cause of that hemorrhage then becomes the underlying cause of death. So don't just take it that whenever somebody feels one condition on line A, it is both the immediate and underlying cause. No, there are situations where a condition feel line A is not necessarily the underlying cause of death. So it tells you that you need to look for the underlying cause of death. A case in example is severe hemorrhage. And then you need to find out, is it because of rupture of the uterus? Is it because of placenta abruption? All those they need to explore. The immediate cause, the other conditions leading to the immediate cause are entered in a sequence on the lines B, C, and D. Always the underlying cause, the last field line is the underlying cause of death. Of course, the same condition that the same criteria that I explained also applies. Say, for instance, if I filled something on line A, I put something on line B, and I stop the third one, I feel it is on line C. Line C becomes the underlying cause of death. Don't say underlying cause of death is always recorded and in line D, no. Underlying cause of, as long as if you're filling two lines, the condition you put in line B will be the underlying cause of death. The one you put in line A is the immediate cause of death. But of course, the conditions that I explained apply. If line B is talking about something like severe hemorrhage, that can be the underlying cause of death. You need to find out more what caused the hemorrhage. That means you have to go again to fill line C. I don't know whether this makes sense. I want to hear whether anyone has understood this. If one person has understood this, then it means I'm making sense. Anyone has understood what I'm saying? Just unmute and say yes or no.
I do. Yes, I have.
Okay, excellent. So we can continue. I just wanted to hear that. Also to make sure that you're not sleeping.
We are not.
Okay. All right, thank you. So then we have other significant conditions contributing to death. So for instance, a mother dies of immediate cause is severe hemorrhage. Then the underlying cause, in line A, I put severe hemorrhage. In line B, I put abruptio placenta. So I know the immediate cause of death is severe hemorrhage, and the underlying cause of death is placenta abruptio. But this mother also happens to be a diabetic, for instance. Diabetic doesn't fall in that sequence that contributed to death. Okay, so if she happens to have diabetes, then you put diabetes in this number 2, which is other significant conditions that contributed to death. Diabetes is not in the sequence up, but it may as well have contributed in a way, in another way, but it is not in the sequence of events that led to death. So if somebody has an existing medical condition that is not in the sequence of events, it is recorded as other significant conditions contributing to death. Importantly, the time interval must always be recorded. The death might be instant, it can be in minutes, it can be in hours. I mean, the diseases, condition leading to death, the duration must be recorded. If the interval is not known, you write an unknown. Never ever leave that part of the interval blank. It is one of the do's of completing a medical certificate of cause of death. The interval of the interval between the onset of the condition and the death is a must. Never leave it blank. Never leave it blank. Always record. Severe hemorrhage, 3 hours. placenta abruption. You may not know when the abruption set in, you put an no. Something like that. Always make sure you don't leave that part blank. Then the other conditions. So other medical data. So we have, you need to record whether this person who died had any surgery or underwent any surgery within the last 4 weeks. That information should be provided. Don't just focus on frame A. Frame B is where you should really always record information. Manner of death is important to record. By manner of death, there are broadly two manners of death. It is either a natural death or an unnatural death. If somebody died of old age, it is a natural death. If another person died of cancer, it's a natural death. If it is a hypertension, it's a natural death. If it is a severe hemorrhage due to abruption placenta, it's a natural death. But if the person died of an accident, it's unnatural. A gunshot wound is a natural death. Poisoning is a natural death. All these unnatural deaths actually require an autopsy. Okay, it requires, most of the unnatural deaths are actually deaths that need to be investigated because in most cases they end before a judge. Suicide is unnatural. Okay, so you need to record all those. Was it? And then of course there are those the subtypes of the manner of death. Is it disease, accident, intentional self-harm, and so legal intervention and so on. So for instance, what would be a legal intervention? If he says legal intervention, if somebody was sentenced to death by hanging and you are filling the death certificate for that person, then that becomes a legal intervention. It's a natural death, but it is due to a legal intervention. I often also give an example of if somebody, a policeman shoots a robber at a bank, okay? A man has gone to rob a bank and is shot dead by a policeman. Is that death legal or is it illegal? That always generates a heated debate because some people say it is illegal because the policeman is legally mandated to shoot somebody to death. Others say no, it is not legal because you're not supposed to take life until somebody is convicted and sentenced by the courts of law, whether you're a policeman or not. So it sometimes depends. You also need to know or have a good understanding of the laws of the country for you to be able to complete sections, especially related to unnatural causes of death. Place of occurrence of an external cause. Somebody was shot or an accident or somebody fell from a building. Where was that place? That information has to be provided. I think we have an example of a pregnant woman who was knocked by a car somewhere down. As a scenario, we'll look at some of this. Then for fetal or infant death, you have to complete also this section. Was it a multiple pregnancy? Was the child stillborn? Was the death, or if the death was within 24 hours, you need to specify number of hours this child survived, and so on and so on. You need to pick this medical form and try to play with it, make sure you understand it fully. Then for women, you need to record whether the woman was pregnant. So pregnancy is any important information that needs to be provided. Actually, previously there was a separate medical certificate of cause of death for mothers and babies. It is still there, and there are still other schools of thought that push for use of that medical certificate, which is totally, I don't have totally nothing wrong with it, because it is all about capturing as much information as possible. But this simplifies, this certificate simplifies everything. So why did WHO develop the International Medical Certificate? This international form is just to ensure standards in the reporting of data within and across countries. So the idea is that if all countries are using the same medical certificate of cause of death, though the section, the demographic section is adapted at the country level, we are going to ensure coherence or congruency in the data collected both within and across the countries of the world, because we want to ensure comparability of data. So that's really the reason why WHO developed this international medical certificate of cause of death, and many countries now in the region are actually adapting this medical certificate to their context. So we have now looked at the international medical certificate of cause of death. Let us look at the do's and don'ts, what to do and what not to do. The first point is, regardless of whether the law requires it, the emphasis is it is the professional responsibility of the attending doctor to complete the death certificate. This responsibility is what the doctor should not shirk. Completion of death certificate should be part of the patient's end of life care provided by the doctor, as I mentioned. I've used the word doctor here, but it's not necessarily the doctor. It can be any attending health worker. When somebody has died in your hands or you've been attending to the person, then have the responsibility, have the courtesy to complete the medical certificate of cause of death. Again, to emphasize, a medical team should be put together in each healthcare facility to do medical certification of cause of death. What actually is important, going back to the first point, is having a legal framework in the country that requires doctors to complete the medical certificate without necessarily having to face prosecution. The challenge in many countries, when it becomes a legal requirement, the police jump on it. When they tell you to do medical certification, if you delay, they're already thinking of prosecuting you, they're already thinking of arresting you. So that's where we need to put some caveat. We need to have engagement with the legal department to say, look, don't go around arresting medical doctors or health workers because they have not completed a medical certificate. Engage with them, encourage them to do medical certification of cause of death. In the case of accidents or violent deaths, additional input may actually come from a coroner. This is like somebody who, you know what a coroner is. For deaths that occur where there's no doctor, verbal autopsy should be done to provide information on the cause of death. The person who completes and signs the medical certificate of cause of death is referred to as the certifier. This I've already explained. All entries should be typed or written legibly in black ink. These are the do's, without the use of abbreviations, alterations, and you don't need to erase anything. You don't need to cross and write. No, that's not accepted. Write clearly. Your handwriting should be clearly readable. I know as health workers, we have the worst handwritings on earth, but we should try as much as possible to make sure whatever we write is readable. As much details should be provided as possible, especially where somebody is going to be picking this to do additional coding. In the case of death due to injury or poisoning, the external cause of the injury is reported as the underlying cause, and it should be specified by manner, whether it is unintentional, intentional self-harm, assault, and so on. The mode of dying, this is for the sake of emphasis, the mode of dying, such as cardiorespiratory arrest and so on, should not be reported as the immediate cause of death. If the cause of death is unknown, even after investigation, it is correct to record it as unknown. Don't forge. If you don't know the cause of death, just say unknown, you don't know. Because if you forge and this certificate happens end before a judge, you are in trouble. So you are safer saying you don't know the cause of death than forging a cause of death. Provide a clear sequence of events. We already look at how the sequence of events is in ascending order from underlying cause to intermediary and to immediate. Only conditions that are part of the disease sequence should be entered in the part 1 of frame A. We have already looked at this. Underlying cause of death is reported alone on the lowest used line on the cause of death certificate. In many instances where one line has been filled, the immediate cause of death is also the underlying cause of death. I've already explained this, but note that there are situations where this may not be the case. I already gave an example of this, of a mother who died of severe hemorrhage and somebody just feels severe hemorrhage and stops there. Naturally, that will be the underlying and also immediate cause, but in this case, it will not be. Now, I want to go back to my second bullet point on conditions that are part of the disease sequence. Their condition, their situation, say if somebody died of TB and the person has HIV, HIV has contributed to TB, okay? HIV doesn't cause TB, but it makes somebody vulnerable to TB. In such a situation, the two are together, they form a sequence. I want to be clear to you on this. Okay, there'll be situations where not necessarily condition A must cause B. No, so it's not about the causal sequence as such. An association, a strong association, HIV is associated with, or TB is associated with HIV. TB is HIV or pneumocystis carini pneumonia is associated with HIV. These form a sequence. These can be filled as part of the sequence in frame A. I hope this is clear. Do not force diagnosis, and the time interval from onset to death will be recorded. I already explained this. If the distance is a pregnant woman, the form for women was a woman pregnant should also be filled. If both mother and baby die at birth, two separate medical certificates of cause of death should be completed, one for the mother and the other for the baby. In the case of fetal death, in most cases, maternal condition that cause the death is the underlying cause. In the case of unnatural death, the external event that initiated the chain of events should be recorded as the underlying cause. Be as specific as possible. If it is an accident, specify the circumstance, place of occurrence, and the intention. If it is alcohol or drug, specify the use, how long had the person been using this. If it is complication of surgery, specify what surgery was it. So the point here is try as much as possible to be as specific as possible. And the point I put in red is very important. Practice makes it perfect. You're not going to be an expert in complete medical certificate of cause of death on the first instance. But the more you practice, the more you discuss with the colleagues, then you're going to be an expert.